Hi, I am Dr. Rasya Dixit. I am a dermatologist working in Bangalore from the last 18 years. And today I am here to answer all your questions about skin and hair related queries. All of us are getting older, but nobody wants to look old. So even as early as your 30s, we start seeing visible changes of aging on the skin. And they could be as simple as pigmentation, which could come because of excessive sun damage. It could be early loss of volume in the under eye area, which looks as a dark circle, or the periorbital pigmentation. It could be the appearance of fine lines or wrinkles in the smile area, which we call as the crow's feet. It could be the deepening of the nasolabial fold, and definitely it could be appearance of wrinkles on the forehead as well. So when we look at all these changes, we want to know what are the things that we have to do to address the changes of aging in our 30s. The absolute must-have ingredients when you're in your 30s is definitely a good sunscreen and a good moisturiser. Vitamin C if your skin is not sensitive, retinol if you're not planning a pregnancy and your skin is not sensitive, and niacinamide are great to have as well. Remember that this is the time when your skin starts to show the early signs of aging. So you can be developing open pores, you may be developing fine lines and wrinkles. So having a hyaluronic acid also will help to keep the skin's moisture in content as well. Remember that the aging of the skin is happening from within and without. So there is external factors and there is internal factors. There are some of the internal factors which are like the hormonal changes, which are like the stress which the body is going through. But the external factors like the diet, sleep, exercise are something that you can control. So let us not talk about aging of the skin only from the skin point of view. Let us talk about the lifestyle as well. Once we have sorted that, we have to come to what are the skincare things that we can do. As we come into our 30s, the skin turnover of the skin becomes slightly more sluggish. So the skin starts to look more dull, the skin starts to look more lifeless. So using a weekly exfoliation using a AHA-BHA solution is a good idea. You can either do it with a chemical peel in the doctor's office or go for a hydrafacial or an oxygen facial once in a month. This will keep the skin turnover going well. Adding on a retinol, a vitamin C serum and niacinamide based on your skin's diagnosis by your dermatologist as advised by them is a very good add-on. Using an oral sunscreen, using an oral vitamin to help to delay aging like a superoxide dismutase will also help the skin looking its best. Absolutely not. It is probably the correct age to start building your skincare routine. When you're in your 30s, that is when you have time to devote to yourself and you should start paying attention to yourself. So please do pick up a correct face wash, moisturizer and sunscreen. Go speak to a dermatologist, tell them about your skincare goals, be it pigmentation, be it acne, be it dull skin, be it anti-aging, and then pick up the kind of actives that they are going to recommend. Then you can get started. And the ideal night routine for a working professional when you get back is to do a double cleanse to take off your makeup and sunscreen, and then do a second wash to keep the skin hydrated. Use a good moisturizer and then use a serum which has been suggested by your dermatologist. This could have hyaluronic acid if your skin is feeling dehydrated. It could have retinol if you are looking at exfoliation. You can have vitamin C if you're looking at getting more radiant skin. But remember, all this has to be prescribed by the dermatologist because this is just general advice. Your skin is unique, you are unique, so you need to ask the doctor for a unique prescription. There are a lot of treatments which are now being accepted more readily in treatment of aging, and Botox, fillers and lasers are some of them. Some of us unfortunately tend to develop more signs of aging than the others. It could be because of the various stresses that you are undergoing, or because you use those muscles more frequently, or because you lost weight. So then if those have to be treated, we will need more than just a cream or a serum or a face wash. You may need some Botox to reduce the wrinkles around your eyebrows or on the crow's feet area. You may need filler in the under eye area because that is the area where most Indians tend to lose volume first. And you may also need lasers to address acne scars or pigmentation. And it's absolutely safe and there is no need to worry as long as you are going to somebody who you know is a qualified expert. Look for a dermatologist and go to the dermatologist.